my number one goal for my patients is for them to be happier than after they see me than before they came to see me. I mean, I see my role as really being their best advocate in medicine, taking what they tell me, combining that with what I know about the current research and treatment options and diagnosis management of their condition, discussing that with them, and then coming up with a plan together that really works for their lives. And then hopefully, if we get a good plan together, they can get completely better, in which case they don't need me, which is fine with me. And if they get better but still need me, they can always know that I'm there to sort of constantly advise them as things change in the field to affect their condition. I've had really rewarding patient experiences that have really reinforced why I went into medicine. I mean, I had one patient that came to me who was HIV, Hep C co-infected because he had hemophilia as a child and got a lot of blood transfusions. He was in his early 30s, had 4 kids and a family, and basically nobody was willing to give him a liver transplant. And so he came to me, and I advocated pretty hard for him to get a liver transplant, despite the fact that a lot of centers simply don't do them, the patients don't do well, etc. And we did get him a liver transplant, and he is doing phenomenally well, 10 years out. And so, I think that made me feel really, really good. And so I think that kind of experience just reinforced my desire to really, again, take everything I know and really advocate for the patient to do what's really right for their life, even though there are procedures and other things that other people would say, well, that would never work. But it did work in this case, and his kids appreciate it. He's a coach at the high school team, so they keep sending me letters saying thank you for all your help and keeping him alive, really, to be able to do all these things in his life. So I think those rewarding moments are worth everything to me in life.